Thank you for joining me. Today we're going to be talking about the CS3D imaging software, and the case we'll be using is a 8100 3D case that is an 8x9 taken in standard mode at 150 microns. This case is also featured in a prosthetic-driven implant planning and its effects on implant placement clinical case study by Dr. Marks, and a very useful case to be able to show. Additionally, he goes further into this one and shows how the protocol comparison using our prosthetic-driven implant planning module allows for 3 visits versus a traditional methodology that allows for 6 visits. Let me begin. The CS3D imaging software, as you can see here, is opened up to the curved slicing tab. This is the most popular tab that allows for views looking down onto the teeth, an axial view, a curvilinear view over here on the right, following the arch of the patient, and down below, a transaxial view. We can move through any one of these views coming over a tooth, or if, let's say, we want to look in the maxilla here, we can change the angulation to better follow that anatomy down the long axis of any tooth to see how it presents and be able to see a little bit more clearly in this case. Exactly that anatomy in this case. We could see the thin buccal plate, the palatal plate, the apical anatomy of the tooth, and what looks like the results of some bruxism. Once we have this, we can use the software very effectively, just clicking to the area we want to visualize, changing our angulation, and coming down that area to pick the area where we want to place an implant. Our implant planning can work as simply as clicking on your implant placement tool, picking the area where you want an implant to start, and picking the area where the distance where you want the implant to end. It will then go through, excuse me, based on the implant selection, in this case, Zimmer Dental, but you can choose from one of the 70 implant manufacturers that we have in our database, and you can go through any one of these and choose not just the implant manufacturer, but the subsystem within that. So we have lots of different manufacturers in here, and each one of these will have subsystems underneath each one of those, allowing you to choose the implant system that works best. But as you saw that I chose that implant location, it makes the suggestion from the implant library that I've selected of a 13 by 4.06. I can select OK, and I can see that implant in that area. Once I have that implant placed, I can choose to make that implant wider, 4.7, 4.72, all the way up to 5.97, where now you see the implant change from purple to yellow. And these do match the color that is in the surgical guide kit that comes from these implant companies. Additionally, I can modify this to make this implant longer or shorter based on the implant choices available from that system. That's a very easy way to place an implant. I'd like to show you a more comprehensive way, not more difficult, but more comprehensive. So we have a lot of features within this software. We're not going to do a deep dive, but first of all, I can easily trace the nerve canal. So I can see where the nerve canal is on this view and know what area I want to avoid. Next, I can go through and add in models. So I can use, in this case, a 3600 scanner to be able to see not just the teeth, but also the soft tissue underlying the teeth. So I can get a better idea of what's going on. And as you saw, it automatically overlaid. I do want you to understand a little bit better about how this works. So what I'm going to do is add in the maxillary model so you can see it a little bit better. So what I would do then is click on Align a Model with the Patient Volume. Now, this patient has a 3600 scan taken of both the maxilla and the mandible. The mandible's been added. The maxilla has yet to be added. The nice thing about using all CareStream products is our seamless integration. With other systems, when you want to align something, you need to have multiple items. You need to set this up so that you match points to be able to get those done. With ours, that does not need to occur. So right here, we can see that the maxilla is right here. We will click Align. We click Confirm. And in just a few seconds, this one's going to be merged into our 3D data set and automatically aligned, which we could modify afterward. Now, one thing I'd like to point out is if you don't have the 3600, that's okay. Our cone beam CTs, the 9600 and 8100 and 9300, all allow you to scan PVS, alginate, a stone model, or a denture and be able to align that automatically as you see here. The only difference will be that it won't be in color. Obviously, a cone beam CT scan can't pick up the color that the intraoral scanner does. So it is aligning the model. We need to have at least 7 teeth, so it needs to be an 8x5 or 8x9. And you can see it aligned it quite well. Once we do this, we'll see these lines that appear on the axial coronal and axial transaxial slices. That is the soft tissue profile, and you can see how well it matched. So in some levels, when we go and look at this, we're coming across and looking at various slices. But if we take a look down here, this is the soft tissue profile and gives us a better idea of what we're working with. As we go through here, we can see it picks up on the tooth, and coming back, it picks up on where the soft tissue is. So now that we have our model added, we can see where the teeth is, where the gingiva is. We can take the next step, which would be to use our crown library. So with our crown library, we can take a crown and we can place that, a virtual crown, on any edentulous region or over an existing tooth that we might want to replace. I've already placed these, but once you place them, you can change the size, the angulation. Just by clicking on a crown, you can see that a lot of tools open up on it. Now, we're not going to do that right now. We're just going to keep it there. But I want you to see that. Let's bring that up a little bit larger. Here you can see the crowns that have been placed 1, 2, and 3 into the various areas. And from here, our prosthetic-driven implant planning allows us to do what we call a crown-down approach. So from the outcome that we want, we can work saying, this is where the crown is. Let's take that and use that angulation to determine where we want to place the implant. So we modify our 3D rendering to bring it down, and here's the implants. New to version 3.10, we now have an implant safety zone. So you can see this box around the apical aspect or the actual most of the implant. And that box is going to let us know if we're in the safety zone. Should we be getting close to an adjacent implant? Should we be getting too close to a nerve? That box will turn from a clear over to a red color. So what are we doing exactly with this implant planning? I make it look very easy by just clicking on the buttons, but let's take this implant right here that I'm making blink, and let's remove it and start this up one more time to show you the difference between what we did before and what we do now. So once we work with one of these crowns, in this case number 30, I can say center back on crown, and here I am on that crown. When I click the implant icon, if your eyes focus right here, you'll notice that when I click it, a blue circle appears underneath it. It's locking me down to that crown. So when I start my first click and I go to choose my distance, you'll notice it also has underneath it the angulation at which I'd be coming off this crown. So I can choose to have no angulation or whatever angulation I want. Now I go to place this implant, and we can see, let's pick 10, even though it's suggested at 13, just for the sake of this presentation, and click OK. Let's zoom in a little bit further so we can see this a little bit more clearly. Now when I go through and choose my various implant size, I could make it longer to 11.5, longer to a 13. And I think that's the 16. Here we go. So once we turn to the 16, we could see the implant turned red. So it gives us a visual warning that where we're planning on placing this implant is too close to the nerve. I will bring this back from a 16 to a 13, and we're in a nice margin of safety. So we can see here for this view, not only can we see the implant, we can also see the working angle that it's coming out and the crown. And once I have all of this down, I can modify a lot of things, such as where this call out is for the Zimmer dental tapered screw vent. And Now that I have that complete, I can move any one of those texts to an area where it's easier to be read. Because the last part of this is not just the planning, but we find that it's very important for patient presentation to be able to get this where you want so that you can present this to the patient and they can understand your treatment plan. So the last part of this that I think is very important to show is our implant planning module, which is the implant planning report. So once I've lined these up to where I want them to be, I can choose an angle, and then I can click on my implant planning report. Now in this case, I've already copied over the text for the diagnostic notes, but you could easily copy this over from your practice management software with a simple copy and paste. I click OK, and it's going to be generating a report. It's going to grab all of these images, and then it will dedicate a single page for each one of the implants. And if you look down here in the lower left-hand corner, you'll see that it also is going to grab not just the 3D rendering and the angle that I've chosen for it to show at, but it's also going to grab an occlusal view of the maxillary model and the mandibular model, 1 and 2. And then it puts this all into an interactive Adobe Acrobat PDF, a portable desk format. In other words, something that everyone has and is able to open on their computers. So you'll see now that I've got my images coming in. I can select other images if I want that I've captured images of if I wanted to replace them. But you can see my implant sites 1, 2, and 3, 1, 2, and 3 are for implant sites 18, 14, and 30. And that these are catalog length and catalog diameter, and there's my notes. So I can even go further into my notes and make this just a little bit bigger to see, center this up, change the text to bright yellow, and click OK, and it will show me on the report what I'm working with. Going to the second page, I can easily zoom into any one of these implants. In this case, this is the implant we're looking at. We can see the slices 1 through 5, 1 through 5 down here, and then we can see the implant up here. Going to the second implant, implant number 2, we can see the slice spacing and the thickness. I can zoom in to see that one better, move this one around, and center that one in here. I, of course, can change brightness and contrast to meet my needs. I'm going to implant site number 3. Again, this may look like a little bit of work, but imagine that your staff member is doing this for you and that you're not only presenting this to the patient, but you're sharing it with the referring doctor or any other colleagues who might be working on this case with you. It's very impressive, and it can also be sent home to the patient. So once we have everything that we want and we're happy with what we've got, we click on Save as PDF, and it will allow us to save it down with whatever name we want, such as Implant Report Sample. I'm going to cancel because I've already done this, and let me show you the final result. So here is page 1, page 2, page 3, page 4, page 5 of this Adobe Acrobat file that's only 3 megabytes. That is a great way of sharing your case presentation, your information, and of course you would have your logo and your information in the top left. So it was branded for you, not for Carestream. So very powerful features within our software. There's much more you can do. And we'll be releasing very soon our Blue Sky plan integration. So if you do have our prosthetic-driven implant planning module and you have Blue Sky loaded, you will have this icon within the software when you're on version 3.10. Again, you need the prosthetic-driven implant planning module, and there will be no extra cost for this integration. But when you click on the Blue Sky Plan logo, your model alignment, your nerve canal, your crowns will all be placed in there, and there will be a placeholder for where your implants are currently, so you can angulate and place implants using Blue Sky implants, what comes in their software, to match the angle that you've chosen within our software. So you don't have to replan again very much. You save your work, and it is easily and quickly implemented into the Blue Sky software. As you can see here, it loads up the DICOM data set and loads up the other items that I've mentioned into the Blue Sky software, and you're ready to plan and print a surgical guide Lab Pronto allows you to do this for only $49. So ease of integration, seamless between the STL and the cone beam data sets, the CAD-CAM intraoral scanners, or the ability to scan objects with our systems, the integration with surgical guide creation, and a very powerful feature set that allows you to see so much more and to be able to work with these in a very comprehensive and functional way so that you can meet your needs and see very quickly all of this data in here. Excuse me, in this case, the crowns have not come through. Maybe that is a future release. I apologize. Thank you very much for your time, and we hope that you select Carestream Dental. If you'd like to learn more about our software, please visit us at carestreamdental.com, or if you'd like to learn more and be more educated on the software, please visit us at carestreamdental.com/learn3D for lots of educational videos that can be found on the bottom of the web page.